your feedback on specifics would also be appreciated, because I know you got a lot of part-time workers in the industry and that sort of thing, and the Senate bill, as I understand it, is a little more friendly along those lines. So if there are we're down to crunch time on this stuff, so if there are section references or wording that you all are interested in, Trevor is working with me, I'd be interested in taking that down. I have some of the same concerns. I mean, the so-called average business, picks up 72% of the individual's premium and 65% of the family. Well, that's great if you're a huge corporation, or a wealthy individual, but for most real small businesses, you pick up the family, or if you do, you pick up a portion of that. And my leadership, I don't think, understands that. They come from a different background and a different orientation. So I need to get better numbers. I can't just say, no, I don't like this. I need to have, it would be more effective, frankly, if I could have some feedback on specifics. And there are some exemptions too. You guys are probably aware of that, where and most of you guys are bigger than this, but in the Senate bill it's under 50 employees, and on the House bill it's this $500,000 payroll deal, and they graduate the penalty, if you will, above that. But there was also this tax credit issue, and that has changed. Originally, the way it was worded in the first House bill, small businesses with a modest number of employees, and I forget the number, might have been in the 25 to 30 range, whose average wages were like under $25,000 to $40,000 a year. So, quite frankly, people in my business, maybe in yours, you would get a 50% tax credit from the federal government towards your health care, either credit or subsidy. And my question on that was, number one, you draw the number of employees line, how many businesses does that exclude? And so I'm trying to find out where that would be best set. And the other thing is that credit goes away after a few years. I think it's 2 years. And I don't know too many businesses, even if you were doing really well, that you're going to, especially if you're a startup business, where you're going to be in great shape to be able to live without that tax credit for a period of time. So that's one area that I identified, and if you guys identify some more in the next week or so, not putting pressure on you, but within the next week or so, that would be very helpful for me.
I think one area is the definition of what a full-time employee is.
Okay.
If I remember correctly, we're looking for a 30-hour week as a definition. Is that correct?
Yeah, I think as far as the one too, they were talking about what was that? The total hour.
Short.
Yeah, right. Well, I think that the House bill obviously has a 30-hour work week, which we've gotten feedback from our members that's extremely unworkable for the restaurant industry, and the preference would be to move it to a quarter, an assessment of time over the course of a quarter, 360 hours over a quarter instead of a 30-hour work week.
That's good, right, Trevor? Okay.
Congressman, that is in the Senate bill. That was a amendment brought by Senator Cantwell from Washington, and that did get put into the Senate bill. So it's an improvement.
Okay.
That needs to stay in negotiations.
Okay,
yeah.
That's good for me to know.
And the other thing that was improved in the Senate bill was the waiting period before someone is considered an employee. They moved it up to 60 days before any penalties kick in. The industry was hoping for it to be 90 days because of the huge turnover we have in our business. But 60 is an improvement over what the House said, which was 30. So obviously our preference would be 90, but if worse comes to worse, if we could keep it at 60, it's much better than what was originally in the House bill.
Good, thank you. That's super.
So you asked for some specifics, and we did some calculations. We have about 3,000 employees, and we made some assumptions on how many would be single covered and how many would be family covered. But in order for us to offer health care, it would cost us over $12 million a year to provide that. And even if we took the penalty and didn't offer insurance, it would be $1.7 million.
Okay.
And that's a huge hit. I mean, either we'd have to increase our menu prices, or we'd have to lay people off. Or both. And another question I have is, how would you define the plan costs? Currently, the insurance industry defines plan costs as your costs minus deductible and co-pays. And if that stays true, then employers would most likely offer plans that had higher deductibles and higher co-pays, which is going to filter down, and people are going to be paying more for their health insurance than they are now. so we wouldn't be able to offer very good plans.
I don't think the specifics of that has been worked out yet. There's a lot of different scenarios, so this is good, as far as feedback. What they've hung their hat on primarily has been what the maximum amount of pocket expense
Mhm.
that an individual could hit. And for people or businesses that already have at least a health plan in place, where the employer is picking up a big chunk of whatever, those people are gonna be in for a real rude shock, because of the other arrangements covering families and this and that. They're gonna have to pick up a bigger chunk of their own health care. And my question in the back of my mind, as I listen and go through this, is not just on the employer's side, but is the employee ready to pick it up? A lot of our folks, at least in my little veterinary clinic, they're not well-heeled enough. I mean, I'd make them share part of the premium cost. I can't afford to pay the whole premium anymore. But I bet under this bill it would increase, and are they prepared